Well, I'm Vanessa Piedra. I've been here at CCA for 6 years, and I am the Director of Behavioral Health Services, and I oversee our substance use outpatient program. I started my interest in substance use right out of grad school. I had worked at Rikers. I had worked with the substance use program there. My experience has been that treatment is not the priority at Rikers. I don't believe that the folks inside, the men and women inside, feel heard. I don't think that they feel respected. And it very much feels like the amount of time that they spend in treatment is their real escape from that, all that harshness that they experience, and then they have to go back to that. So I wanted to make sure when coming here that all of our participants were heard, they felt respected, did not feel like we were the law, which I think is a lot more conducive to the therapeutic process. It's so special when you see clients start to make the progress and see the change in themselves and want to strive for better. I think clients definitely hear our message and want to incorporate that into their lives. And there's lots of different aspects that may have been barriers, upbringings, their communities, parole officers, that may make them feel discouraged to make those changes. I think the folks that use medication get a bad rap. You're switching one drug to another. So clients get a schedule. They come here for however many hours that they come. They have a substance use counselor that they work with. And I think what's great is that we usually don't treat in a silo. There is so many people involved in that one person's treatment. So if a person has substance use and mental health concerns, and employment needs, this particular person would have not only a substance use counselor, but also a mental health specialist that they would work with, and also an employment specialist. And every client looks different. We very much focus on individual care. So one client may have 2 people involved in their treatment, another may have 4.
An additional service that we're looking to provide is medication-assisted treatment. Numbers for opiate addiction have increased so much with fentanyl, with drugs being laced with fentanyl. It has certainly increased the number of addicts to opiates, overdoses, etc. And we've done our part to try to support the growing epidemic of opiate users. We've started with providing Narcan and training all of our staff and making this something that's available to all of our participants. And now I'm very excited to share that we are starting now on the medication assisted side of this.
With us, they see a way different, a different way of being. And I think we have a really great team. My counselors, they are very supportive of their clients, where they start to feel encouraged that they can make that change. I think that was another very big draw for me to come to CCA.